Hi, my name is Heidi Hill, and this will be my SWOT analysis on Encompass Health Incorporated. Encompass Health Corporation is an organization that I chose for this analysis. It has programs and offices in 39 states plus Puerto Rico. In this SWOT analysis, according to Minnesota Department of Health, it provides programs and organizations with a clear, easy-to-read map of internal and external factors that may help or harm a project by listing and organizing the project's strengths, weaknesses, opportunities, and threats. The mission statement for Encompass Health Corporation reads as follows: to be the healthcare company of choice for patients, employees, physicians, and shareholders by providing high-quality care in the communities we serve. This company offers inpatient rehabilitation, home health, and hospice program. They were founded in 1984. An organizational overview for this analysis includes some of the strengths, the weaknesses, organizational volume, forecast, financial condition, and strategic performance. Encompass Health Corporation is a very successful business in the healthcare industry. They have offices across the country. They are one of the largest systems of rehabilitation hospitals in the United States, and that includes Puerto Rico. Part of being a large corporation is the stigma of being more concerned with money rather than the patient care that they are providing. So the company needs to really work on destigmatizing that view toward patients. They can also have a tendency to be short-staffed, which can make employees feel overwhelmed and overworked at times, and this is due to the nationwide healthcare shortage at this time. Some of the strengths of Encompass Health include, as I mentioned earlier, they offer inpatient rehabilitation, which is hospitals that they have in various states across the country. They offer home health, and that can include going to private residences or other assisted living facilities, hospitals, and that type of thing, and hospice services. And that can also include going into patient homes or various facilities where the patient might reside. There's a diversity in the trained staff across all disciplines that includes aides, nurses, management, and so forth. There's a great team environment, and there is a lot of support from upper management for those clinical teams. With the many types of care providers among the clinicians, there are many years of experience and a lot of knowledge among staff members. And as St. Cloud State University puts in their strategic plan, Encompass Health is also strong and has established partnerships within the communities where they support patients. More strengths include using technology for electronic health records. This makes it much easier to share information for clinicians across different service providers so that you have better access to information such as known drug allergies or previous adverse reactions that a patient may have had to a treatment or a medication. There's also excellent training for new employees that onboard, as well as continuing education for existing employees. They do, again, have established relationships within each community, but there's always room for opportunity and expansion in each community. They also have great benefits for full-time employees, which include time off and health insurance. Some of the weaknesses that Encompass Health may have, some areas may be short-staffed due to lack of available qualified clinicians across the healthcare marketplace. And again, this can make employees feel overworked or overwhelmed and sometimes just not appreciated when they're pushed to their limits week after week. It's difficult at this time to market in all desired areas because some places still have restrictions due to the COVID pandemic. So we're not always able to get into maybe hospitals or acute care settings at this time. Marketing could be more directed and available in local markets, and that will be covered a little bit later in the opportunity slides. Another weakness that may come across in Encompass Health, there can be a lack of understanding. So with a big corporation, there are goals and incentives that management is aware of. And clinicians are also aware of it, but they may not always understand why those goals and incentives are in place and what is the best way to reach them and what tools they can use to effectively reach those goals and incentives. There can be a focus on profits, and this can also distract clinical staff from the care that they're giving patients because they become more worried about the number of visits or patients they're seeing in a day or a week, as opposed to the quality of care or length of a visit to a patient. They do also encourage paid time off for clinicians, but because of packed schedules at this time, it can be difficult for clinicians to take any of that paid time off, which again can result in people feeling overworked and just weary in general. Some opportunities for Encompass Health. They can educate facilities, patients, and the community in general about the types of services that they offer. And again, this will include inpatient rehabilitation, home health, and hospice care. They should allow for marketing activities at a wider range of events and facilities. Right now with the pandemic, events are starting to come back slowly, and healthcare facilities are slowly starting to open up and allow things such as hospice aides, home health aides to come into facilities with a little bit less restriction than we've seen in previous months during the pandemic. Another opportunity that seems to be a smart one would be the fuel costs that employees are currently experiencing due to the high cost of gas. If the company could try to reevaluate their mileage reimbursement to employees to match up with that increase in fuel costs, that would be a really effective solution, and I think clinicians would be really happy with that kind of help. More opportunities include engaging with local businesses for access to patients who may qualify for services. So getting the Encompass name out there would be a really good marketing opportunity. We also could educate all levels of clinicians on who qualifies for services within Encompass Health. And we can also educate on limits to what services we can provide and the disease process across all levels of service and clinical experience. Some of the threats Encompass Health may be experiencing are competing companies throughout the region. So there are inpatient rehabilitation hospitals, there are home health services, and there are hospice services in almost every local community where Encompass Health exists. So if we can get our name out there and have good word of mouth, good marketing, and the Encompass Health Corporation being first and foremost when someone thinks of any healthcare need, that would be ideal. Some hospitals do have in-house rehab, home health, and hospice, and it's very difficult to try to compete with that when people would naturally go from the acute care setting immediately into rehab if it's all in one building. There's no need to jostle the patient or discharge and readmit or any of those extra steps that clinicians find. Also, staffing to appropriate levels can help prevent burnout among Encompass Health employees. It would also be helpful to have an understandable, immediate, measurable result that you can share with potential patients and their families so that they can make a good informed decision about what kind of care their loved one needs. It also is a threat for limitations of insurance payment and qualifications. So it's important to explain to patients and their families what would qualify for Encompass Health services and what insurance may or may not cover. For instance, Medicare will often cover acute care and rehab to get someone back to their pre-injury state, but they would not pay for something such as long-term care, possibly home health care as well. They do cover hospice services, but not for every situation. It really is on a case-by-case basis. And the last threat to discuss is it is really difficult at this time to gain the proper amount of workforce to provide proper care. Because of being short-staffed, people really have packed days, and that can include taking on extra shifts if you're in one of the inpatient facilities. It can be seeing 8 to 10 to 12 patients a day if you're doing home health or visiting assisted living facilities. And hospice can be the same issue. It's really driving up work hours for clinicians who are hands-on with patients in general. In conclusion, Encompass Health is a nationwide corporation with a wide reach of client access, with large corporate access to marketing services and funding. So this can be a benefit because there is access to more money. They have greater financial success and access to finances. One biblical scripture that stood out to me while doing this analysis was John 8:32. And that reads, "Then you will know the truth, and the truth will set you free." It's very important when doing analysis on any business, any healthcare business, really any business in general. You need to be selling the true product of quality care so that the company can be successful. And that piece is specific to healthcare in general. But being truthful about what you can provide a patient helps set expectations, and it helps set expectations for the clinician as well as the patient and their family, knowing that we will do what we say we're going to do and providing the care that we would provide to any member of our own family. This company has an opportunity to educate the public about services that are offered and the ability to provide care on several levels with a Christian viewpoint. Overall, Encompass Health is a great company to work for, and they provide a great service in that we give Christian care to those who need our care. Thanks so much.